What I'd like to talk about today is a local initiative that Pima Council on Aging has been involved in for about 8 years or so now, and it's around end-of-life care. We're part of a collaboration called the End-of-Life Care Partnership. And this partnership has pulled together people and organizations in several sectors with a common goal: to educate people about their end-of-life care choices, to help them make decisions about their end-of-life care that match their personal values, and to ensure their wishes are known and honored when that time comes. And we've done a lot of work in those areas, and there's still a lot of work to be done. This effort started out very small and has just grown in astounding ways in the past 3 or 4 years. And I found it personally that rather than it being a depressing topic to talk about, it's actually been very energizing, life-affirming, and empowering in so many ways. So I want to give you a taste of that today. So joining me to talk about end-of-life care planning and other related issues are PCOA staff that work in this area, as well as 2 of our many community partners in this work. So I'd like to introduce to you Sarah Asher, the Senior Director of the Arizona End-of-Life Care Partnership that's anchored at the United Way of Tucson and Southern Arizona. Algery Wilson, President of the Coalition for African American Health and Wellness in collaboration with Dunbar Pavilion. Deb Sang, End-of-Life Initiatives Coordinator at Pima Council on Aging. And last but not least, Adriana Molina, Bilingual End-of-Life Specialist at PCOA. Welcome to the show, everybody.
Thanks, Lisa.
Great to have you all here. Sarah, let me start with you. I realize you and I can and have talked about this for hours on end, but in a nutshell, could you tell us all what the Arizona End-of-Life Care Partnership is and why it's important?
Sure. The Arizona End-of-Life Care Partnership is a network of organizations, individuals, and end-of-life care resources right here in Tucson, Arizona, and anchored at United Way of Tucson and Southern Arizona. Our mission is to enhance the way we live by fundamentally changing the way we talk about death. And our vision is really to ensure that people get the care that they desire at the end of their lives. This is so incredibly important because death, as we all know, at least subconsciously, is the one thing that every single one of us on Earth shares as an experience. And yet, it's something that many people find difficult to talk about. As a result of that, when the time comes, we may end up in a place we don't want to be, or with people we don't want to be with, or burdening loved ones we leave behind, or people in general who are left behind, with making decisions about what we may or may not have wanted. I truly believe that talking about death enhances the way we live right now. That when we talk about death and what's important to us, what our priorities are, what's on our bucket list, we can start living that way right now. COVID has been a brutal reminder of to each of us about our shared mortality. That there are no guarantees for any of us at any time, at any age, or on any day, and that knowing someone's wishes helps us in times like this. Do you want to be transported to the hospital where you might die alone? Do you want to be on a ventilator? Do you know what the long-term effects of a ventilator might be? Again, what are your priorities? I came into this role after working for many years in healthcare, and I'm more convinced than ever that this work has to be led in our community. My father was diagnosed with dementia, and this was many years ago, and I moved him to Tucson at that time when I was in a hospital leadership position for neurological rehabilitation services. And I went back to our team after several months into the 7-year journey of caregiving. And I said to our team, this is completely different on the other side. Our partnership is the largest funded partnership of this kind in the United States. Right here in Tucson, Arizona, our incredibly special Tucson, where we really prioritize community. United Way of Tucson, Southern Arizona acts as the anchor organization because the mission of United Way is to build a thriving community by uniting people, ideas, and resources. We are truly building a model partnership right here in Tucson, and I just couldn't be more passionate or thrilled about that.
That was a wonderful frame. Thank you for that, Sarah, and for your leadership and the United Way's leadership in this area. We really appreciate your involvement. Deb, Deb, you head up PCOA's efforts in this work. What can you tell us about Pima Council on Aging's role in this partnership?
Thanks so much, Lisa. You know, at PCOA, we emphasize the importance of living well, even through the older adult years. And we're firmly committed to and believe that part of living well means preparing well for dying and for death itself. So what our goal is in our end-of-life work is really to help people throughout our community to think about and give voice to the wishes and preferences that they have, the values that they have around the dying process, and how they would really envision their death to be. Part of doing that is focused on educating community members. And we really focus especially on those that are underserved in our community. And this means looking at the right to choose or to refuse different types of care. We provide them with information about what some of those different levels of care actually mean, what the potential for positive outcomes as well as negative outcomes might be. We also help folks to identify the important people that they need to share their wishes and desires with. It might be family members or friends or loved ones. It might be spiritual leaders or physicians or even hospitals. And we also help folks to identify the person or persons that can speak for and be the voice for that person if and when the time comes and that person isn't able to speak for themselves. We coach folks through the difficult conversations around dying and around death and the wishes that someone chooses for those. And we also help folks to formalize and implement those legal documents that are part of end-of-life care. All of these things we do at PCOA are no cost to the community. And we really strive to make sure that we're relationally sensitive and culturally diverse in providing those services to the community. We're especially committed to ensuring that those sometimes marginalized and underserved communities are being supported and served. Specifically, we are striving to ensure that those who are part of the LGBTQ community have the supports and services and honestly the awareness that they need to be helped through their end-of-life decisions in a respectful, understanding, and compassionate way. So to that end, as part of what we do, we actually provide what's called Visibility Matters, which is a training for assisted living residences, attorneys, other folks that serve older adults who identify as part of the LGBTQ plus community so that they have that respect and that understanding. We also are committed to ensuring that the Latinx community in Pima County is being served in ways that are meaningful and real for them as well. Our commitment is to ensure that all people throughout Pima County have the information, the support, the customized direction, and the personal care and relationship to make their end-of-life decisions.
That was perfect. Thank you, Deb. You mentioned the Visibility Matters curriculum. We're going to learn a little bit more about that later in today's show, so that was a good segue there. So you mentioned that one part of end of life care planning is deciding who you want to be your representative, who would speak for you and make decisions for you if you're unable to speak for yourself. And this involves deciding who you'd like that to be, having the conversation with them, and documenting those wishes. Algerie, if I could jump to you, can you help us all understand why it matters that people formalize who will speak for them when they're unable to?
Thank you, Deb. I mean, Lisa, I'm sorry, Lisa. With my experiences, I talk to people that I want them to document who do you want to speak for you if you're hospitalized all of a sudden and you can't speak for yourself. I find that they have a misconception. They think, well, I don't have it documented and I'm not worried about it. But at the same time, they're in the misconception thinking that, oh, my mom, my dad, my brother, whoever can speak for me. But in reality, no, that's not true. Because legally, someone who is not documented to speak for you, and the document means it's signed by you, it's notarized or witnessed, given to all your loved ones, no one knows your wishes. And so therefore, you're now a surrogate. And with it being a surrogate, if you're taken into the hospital after a car accident, for example, and they're treating you life-threatening injuries, and a feeding tube is part of this treatment, when your loved ones get there, they can't stop that. They're surrogates. They don't have a legal, binding way of doing that. So it's really important that you want to write it down. And the importance of writing it down is so that no one has to try to remember it. What did you say a year ago, 2 years ago, how you wanted to be treated? It's a reliable way. And the person you choose, someone that is emotionally able to speak for you, able to be comfortable in a medical setting, be strong enough to talk for you, even if the family wants to come and interfere, and they know your wishes, they know your values, so that you have that person that can stand there for you and do what you want.
Sounds like that's something that provides a lot of clarity for a person's family and friends and everybody involved if it comes to that, and gives
I'm
people.
sorry, especially when you have emotions that are running high anyway, a stressful situation going on. The more you can prepare your family, this is a gift for your family as well as yourself, a peace of mind.
Exactly. Thank you for adding that. Adriana, you at PCOA have helped literally hundreds of older adults and sometimes their entire families sit down and talk through these issues and make these decisions together. And I know that those can be really difficult and emotional conversations. What's your experience been about what it means, especially to older adults, to be able to have those discussions openly with their families? How do they feel having done that?
I feel like the discussion part is probably one of the most underrated parts of this whole process. We have a good mixture of clients at PCOA. We have older adults who have their documents completed, but have not even told their family members anything that's on their documents. Some of them haven't even told them that they've selected that person as their medical power of attorney, because they have no idea or no clue where to even start, how to begin these conversations. And then we have the total opposite of the spectrum, where people haven't had the conversation, haven't got the document done, have avoided the topic in total. So these conversations are so important, because that 1 hour, 2 hour, or less or more time could be the only time that these older adults are opening up about the topic, about end of life discussions, their wishes, their views, even sometimes their experiences with death, because those experiences are kind of what shapes our decisions of what we want or don't want. So like I said, that those appointments where we are able to meet with family members and clients, they're so important for that reason, because that might be the only time that family or that family member is ever going to talk about this topic or this subject. So like it's just, I don't know, it's just so important. And then I feel like at the end of the day, the best part about these appointments is I feel like it goes from like a tenseful situation and transitioning to like more of like a sense of relief, and then everybody leaves with this sense of gratitude, because now the family knows what the person wants, and the person knows that their family knows what they want, and it's not a bunch of chaos regarding the issue of fighting back and forth or it not being documented correctly. So I would say that would be one of the biggest importances of the issue.
That's awesome. I know that oftentimes it's the family members, often the children of an older adult, that are the ones that are having a hard time having the conversation, because they're like so afraid that talking about it means it's going to happen, or means you have to like acknowledge that it's going to happen. And so in sort of getting past that and just talking about it.
Yeah. And I mean, like I said, we have such a mix. Sometimes we have those situations, or we have the situations where it's the total opposite. The kids are begging their parents, let me know what you want. Let's get this documented. And our client is, or the family member is the one that's can't get past that barrier of talking about death.
Exactly. Yeah, Algerie and Adriana, both of you do significant work in communities of color. And I'm interested in how unique factors like diversity, ethnicity, faith, and values impact our decisions about end of life and the process of talking about it and making decisions as a family. I'm guessing there's a really huge impact there. Algerie, let's start with you first.
Oh, definitely. The pandemic has highlighted this front and center, the disparities, as we've all realized, for the underserved and for the community of color. For instance, doctor visits. They go into doctor visits, and a lot of times we may not know the questions to ask. We sit there, the doctor comes in, he might ask a couple of questions, and out he goes. So then when we go home, we may not have a lot to be able to tell our loved ones what the doctor even said. We won't ask questions sometimes about, well, is there treatments for this? How long will this take? You know, do I have any type of any barriers for me for my daily living? So some of these things aren't necessarily readily asked for. So then on the spiritual side, we believe that God is our Savior, Jesus is our Savior, and we're spiritually in nature, African-American community. And so we know that we focus on knowing that this is temporary, this earth is temporary, this shell is temporary, that we're focusing on getting to Jesus. And I have a really neat story to explain that. I had a friend of my church that it was her end of life, and she was doing everything she needed to do, but the family had a hard time letting her go. You know, they're in the room, you know, either whether they're crying, they're grieving. And she finally said, stop, no, you guys need to leave. I have an appointment. My mansion is ready and built for me. I don't plan to be late. So I just think that was such a neat story. And that's the kind of person she was, just a joyous person.
That's awesome. Thank you.
Algerie makes that's such a good point, Algerie. And I want to go back to something that Adriana said too, about the conversation being really the most important piece. It all comes down to the conversation, and the conversation is hard for everyone, including doctors. Doctors are human beings, as we all are human beings, and a lot, you know, doctors are trained to save people's lives, and so that's the default. That's what physicians are trained to do. So part of our partnership work is also working with healthcare professionals to give them the tools to have these conversations, to make it easier for them and more comfortable for them. And so we have free workshops and trainings for healthcare professionals as well.
Thank you for jumping in with that. I think the relationship between the consumer and the healthcare community is a really important part of this. And so many, I think Algerie touched on this a little bit, that so many of us are just sort of trained to do whatever the doctor tells us to do, and not necessarily realizing that we have, you know, it's really our choice what happens. And we just don't even have that mindset. So part of this work is even helping people think through what choices they really do have.
Exactly.
Adriana, would you be willing to talk to us a little bit about those same sorts of concepts and how you've seen that show up for the Latinx community?
Yeah, so definitely growing up in the Latinx community and working with the Latinx community, there has, and anybody who else who has grown up in it or works with it directly will clearly see the taboo that comes with end of life discussions. I would say pretty much death, period. There's a huge stigma around it within the community. We just don't talk about it. Audrey made some references to faith-based communities and how they view death. I feel like even in faith-based communities, it's just a topic we don't discuss. As far as we get is probably our last rites when we're dying, but any further than that, we don't touch the subject. I think it just culturally, it's assumed my kids will take care of my unfinished business. My kids will make those decisions. And in a perfect world, that is a great idea and it works. But unfortunately, we don't live in a perfect world. And culturally, it's just a continued cycle of us not talking about it, us not dealing with it, and us pretty much putting the burden on our children. And I think every time we say, you know what, I would never do that to my kids because I went through it. And then it's just a continued cycle because we didn't grow up in a faith-based community or at home learning how to talk about death or how to be able to vocalize what we do or what we don't want. So I would say that's just a huge taboo within that culture. I know recently we worked with a family and this is probably one of my favorite stories, and it was so hard to pick a favorite story, but this is definitely one of them. I worked with a family who only spoke Spanish, and this, for them to even find the PCOA program was such a blessing for them because they didn't even know these services were available. They had an idea, but they didn't think that there was any agencies that had these documents in English and Spanish and would have a translator, which I totally get because these documents are so hard to translate from one language to the other. So to be able to find an agency that has them available already in Spanish, so no one has to trust what I'm saying is, correct before they sign it. So right off the back, they were already grateful for that part. So going in, I had arranged, about an hour to speak to them, and it took much longer than that because I didn't realize the depth of this how deep this conversation was going to go. It was, son, daughter, and father, and they had recently lost the mother to cancer, and it sounded somewhat of like a really traumatic situation. That was what was kind of shaping the family. Dad was a solo senior now, all alone. Kids lived out of state, so we had to hurry up and get this appointment all together set up when everyone was in town. And the father was so uncomfortable the whole time. I've never had an appointment like that. Like literally the whole conversation was him just making jokes about death. And like I said, it was just awkward. It was awkward for everybody. It was awkward for his kids. It was awkward for me. It was awkward for him. But I think at some point we just all had to sit back and understand that everyone deals with grief differently. And hey, if that's making jokes about it, then I'm totally going to let that play because I knew at some point the jokes were going to stop and seriousness was going to come out. So for the first entire, I would say probably 45 minutes of that appointment, it was just son and daughter getting things done, talking about what dad wanted, and dad wanted no part of the conversation. And like I said, when it did come to him, it was just making jokes. But immediately, once we got to the living will part, the whole joking around thing shut down. He actually began to open up and let his kids know, hey, this is what I want. I saw what your mother went through. I saw the impact it left on the family, and I don't want that for me. And it ended up coming to be that hospice services were utilized way too close to end of life because the family didn't even know about them. So the family already had this really negative stigma about what hospice was and what it did to their mom and what it did to their family. So by the end of that appointment, the kids got to know what exactly their dad wanted. With all jokes aside, all awkward comments aside, dad was serious, let them know what they wanted because of the impact of what happened with his wife. And we also got to break down that stigma of, hey, hospice isn't for the last hours of life. It isn't for the last day or two of life. Hospice can be a great service when it's utilized correctly.
And I want to jump on that something that you had said. This is the reason why I want to reemphasize. This is a gift, a serious gift for the family when you can just break down and just reduce that chaos and confusion at the end. It is a true gift because I've seen it personally when the family can come together and recognize they need to you know, they need to immortalize the legacy of that person. And the one way of doing it is by showing compassion, by showing camaraderie, by showing we are together, going through this together. And with the help of hospice, because they've got some wonderful services, they help the families with that grieving process, so that at the end, you have a clearer path of how to keep your life going. Because I've seen too many people, life shut down behind death. And that's not what the loved one wants. They don't want that, because that's not what I would want for my kids. I want them to continue doing their life. And that's what everybody would and should want for their families.
Thank you for jumping in with that. Adriana, thank you for sharing that story too. That was a beautiful story, and I'm so glad you're available for folks either in English or Spanish that to help them talk through that and make those decisions and make that a comfortable process for them. Algeria, if folks wanted to reach you directly and wanted assistance with some of this, how would they reach you?
They can call me at area code 520-401-2177. It's 401-2177. We're doing our presentations on Zoom, and as well as a coaching mechanism as well if you don't have a computer. So please reach out.
Perfect. And we'll have put that number up on the screen too, so people can see it. So if I could kind of have Deb turn back to you and have you kind of wrap up the conversation for today. And I'm interested in you letting people know what PCOA specifically can do to help with this, and how people can access these free services provided by us and by our other community partners.
Absolutely. Thanks, Lisa. You know, listening to my colleagues here speak, I'm just struck by the commitment that all of us have to demedicalizing, delegalizing, at least in terms of the conversation and the relationships around these decisions. It really is about compassion and connection and conversation. And that's what I love about this work. It doesn't mean that the legal documents aren't important. As Algeria said, they absolutely are. But we have to start from the heart. We have to start by looking at commitments and values. And I think that's what we've really talked about today. Pima County and Tucson have such rich cultural experiences and spiritual perspectives and language needs too. And it's wonderful that our partnership, our end of life partnership, has partners that can address all of those. We have partners not only focused on providing support and assistance to a Christian faith-based community, but for the Muslim community, for the Jewish community, for those that see themselves as more practitioners of Eastern religion. We have the ability to connect folks not only to Spanish, but to other language supports and services that they may need as well. And again, all of it comes back to doing so with sensitivity for the relationship and really striving to understand what people have experienced, the concerns, stigma, or barriers they bring to the process, and really honoring their values and their wishes in the end. So at PCOA, we really regard ourselves as the place to start. If someone is uncertain about how to even begin the end of life planning process, they have some options. And some folks like to gather some information before they talk to someone. And if that's the case, folks can check out our website at www.pcoa.org. And we have a number of things there, including informational videos, ways to contact us for additional supports and services, as well as links to some of the Arizona documents that are super important. Speaking of those documents, Adriana had referred to the living will, and that's one of the advanced directives that can be established. And what that document does is really describes what kinds of medical interventions I do and I don't want. And it can go beyond that as well, but that's the living will piece of it. In addition, we recognize that some folks want to start with the relationship first, and that's super important. So Adriana and I are really wanting to be that first relational connection, if you will. And that connection may be focused on community-based presentations where we describe terms and define them, where we help folks to understand some of the questions involved in end-of-life care. It may mean that we're connecting our constituents with community partners like Algerie or anyone else in the community who's doing this work that those folks might feel most comfortable with. We can provide that one-on-one or that family consultation, just like Adriana talked about. And we're even here to help facilitate some of those difficult conversations and to coach folks through what they need to say to a doctor or ask a physician. And all of that starting point can really take place by making a simple phone call to our helpline. Our helpline number at PCOA is 520-790-7262. And again, it's just the place to start. And this is part of our commitment to ensuring folks that folks can live well by preparing well for the end.
Beautiful, Deb. Thank you. You know, there's so many parts of this conversation we could have for hours about, you know, the importance of hospice and palliative care, or talking with your doctor, or, you know, so many different things, the forms themselves that you can use. But I think this was a really good place to start, to give people an idea of why this is important, what they can do, how they can help. So thank you.
Forgive me for interrupting. The other thing I would say, you're so right, but also to help folks understand that they can change their mind. They can update their documents or their wishes at any point in time in the process, and we're here for that as well.
Thank you for jumping in with that. That's really important as well. Sometimes people think, well, how am I going to know what I'm going to want when that happens? All I can speak to is what I feel today. And that's exactly the point, is speaking to what you feel today. And you can always change that if you change your mind at some point. So, well, you're all doing really, really meaningful and helpful work for the community. And I appreciate all of you for doing that. And caring about this issue so much, and for being here today. Hopefully we'll have opportunities to talk about this a lot more, but thank you for joining me on Voices today.
Thank you, Lisa. Thanks, everyone.
Thanks so much.
Thank you.
Thank you. Thank you very much.